Hello and welcome. Today we're diving into a critical urinary system condition known as bladder tamponade. This is a serious situation that can quickly lead to kidney damage and requires immediate medical attention. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started. Bladder tamponade at its core is caused by significant blood clot formation within the bladder, obstructing urine outflow. The most common culprit is bleeding from the bladder lining, often due to conditions like bladder cancer, particularly after treatments like radiation therapy or surgery. Other potential causes include severe urinary tract infections, bladder stones causing irritation and bleeding, benign prostatic hyperplasia or BPH, and enlarged prostate leading to blood vessel rupture, and even certain medications, especially blood thinners. Trauma to the pelvic region can also trigger bladder bleeding and clot formation. The pathophysiology of bladder tamponade is relatively straightforward, but devastating if left untreated. Bleeding into the bladder leads to clot formation. These clots accumulate and progressively obstruct the bladder neck, which is the outlet where urine normally exits. As the outflow is blocked, pressure inside the bladder rapidly increases. This elevated pressure then backs up into the ureters, the tubes connecting the kidneys to the bladder, and ultimately into the kidneys themselves. This backflow, known as hydronephrosis, puts significant strain on the kidneys, potentially leading to acute kidney injury. The kidneys struggle to filter blood and produce urine, leading to a build-up of waste products in the body. While precise epidemiological data specific to bladder tamponade is limited, we can infer some trends based on the underlying conditions. Bladder cancer, a major contributor, is more prevalent in older adults, particularly men, and those with a history of smoking. BPH, also primarily affecting older men, significantly increases the risk. Individuals on anticoagulant medications, regardless of age or gender, are at an increased risk due to the heightened potential for bleeding. The occurrence of bladder tamponade following urological procedures is not uncommon, and the frequency depends on the specific procedure and patient factors. The signs and symptoms of bladder tamponade can vary in severity, but prompt recognition is crucial. The most common symptom is the sudden inability to urinate, despite feeling the urge. This is often accompanied by lower abdominal pain and distension as the bladder becomes increasingly full. The urine may appear heavily blood-tinged or contain visible blood clots. Patients may also experience symptoms of kidney dysfunction, such as nausea, vomiting, and fatigue. In severe cases, if kidney failure progresses, there may be changes in mental status. Diagnosis of bladder tamponade typically involves a combination of clinical evaluation and imaging studies. A physical exam will reveal a distended and tender lower abdomen. A urinary catheter is often inserted, and if blood clots are retrieved, it strongly suggests bladder tamponade. A complete blood count can assess for anemia due to blood loss and evaluate kidney function through blood tests measuring creatinine and BUN levels. Imaging studies, such as a CT scan or ultrasound of the abdomen and pelvis, are essential to confirm the diagnosis, rule out other causes of urinary retention, and assess the degree of hydronephrosis affecting the kidneys. Bladder tamponade isn't typically classified into distinct types, but its severity can be graded based on the degree of obstruction and the impact on kidney function. It can range from partial tamponade, where some urine outflow is still possible, to complete tamponade, where there is complete urinary retention and significant kidney back pressure. The underlying cause also influences the classification, distinguishing between tamponade due to malignancy, infection, or trauma, as this affects the long-term management strategy. The primary goals of treatment are to relieve bladder obstruction, stop the bleeding, and protect kidney function. The first step is usually bladder irrigation using a large bore catheter to evacuate blood clots. Continuous bladder irrigation with sterile saline may be necessary to prevent further clot formation. If clots are too large to be removed through the catheter, cystoscopy, a procedure involving a camera inserted into the bladder, may be needed to directly remove the clots. To control bleeding, medications like aminocaproic acid can be used to promote clot formation. In cases of severe or persistent bleeding, surgical intervention, such as cystotomy to directly visualize and cauterize bleeding vessels, may be required. Addressing the underlying cause, such as treating bladder cancer or managing BPH, is essential for long-term prevention. Prevention of bladder tamponade focuses on managing the underlying risk factors. Regular screening for bladder cancer, especially in high-risk individuals, can lead to early detection and treatment. Managing BPH with medication or surgery can reduce the risk of bleeding. Careful monitoring and management of anticoagulant medications are crucial. Proper hydration and prompt treatment of urinary tract infections can also help prevent bladder irritation and bleeding. For patients undergoing urological procedures, meticulous surgical technique and careful post-operative monitoring are paramount. The prognosis for bladder tamponade depends largely on the underlying cause, the promptness of diagnosis and treatment, and the overall health of the patient. With timely intervention, kidney function can often be restored, and the patient can recover fully. However, if left untreated, bladder tamponade can lead to irreversible kidney damage and even death. Recent research focuses on improving techniques for clot evacuation and developing more effective methods for controlling bladder bleeding, particularly in patients with underlying malignancy. Advances in endoscopic techniques and the development of novel hemostatic agents offer hope for improved outcomes in patients with this challenging condition. That concludes our discussion on bladder tamponade. Thank you for watching.